Michael, how's the movement for change doing?
Very well, Lily. Good morning to your viewers and to our supporters in Tamale. You know, we are going there tomorrow.
Okay.
Yeah, God willing. Honorable Alan Martin is going there. Actually, let me seize this moment to say happy birthday to Mrs. Patricia Christabel Martin.
Okay.
The First Lady for the Movement for Change. Soon to become Ghana's First Lady. We are celebrating her today for her birthday. She's been a pillar in this movement, and to some of us a mother, and so I think it's in order. The weekend was a good one, you know, even though a bit stressful with the traffic situation around Legon. I just found myself in there, and there was the Doomsday Vigil going on. But we took consolation in the fact that, you know, it was a good thing. We are all seeing the effects of the Doomsday, and so if people are raising awareness and calling for some resolution to it, then it's a good one, and so we supported them. And so that's it. We are here again, by the grace of God, to discuss issues of national importance.
There was a report by Harmonized Health Service report on Ghana's healthcare delivery, and in that report it suggests that only 5% of health facilities in Ghana are well equipped to offer quality healthcare service. And for us as Ghanaians, this obviously should be worrying. One of the things that also caught my attention was the fact that only 38% of all facilities offering inpatient services have dedicated isolation beds. And also 32% of facilities have access to emergency transport system for patients. So that's also critical here. Let me start with you, Michael.
Yes. So, thank you. The Ghana Health Service, with the help of the World Health Organization, did what we call the Harmonized Health Facilities assessment. Basically, that presents a baseline for to inform policies, people interested in health investments and all that. And having experienced a bit of a health system, I've done some work there with the World Bank.
Okay.
And so what this contributes is very crucial to our development, because one thing that has been a challenge is the fact that we can't even account for our state. What we have, you know, there's no proper documentation to tell people or to inform people who are even interested in doing some investments, contributing, coming on board to help our health sector. And so this is a very important database that I believe we can all pay particular attention to be able to, you know, go about, even as we campaign for change and all that, we can know specifics, which indicators we will want to focus on and all that. Now, that's for a developing country, the fact that most of our facilities lack some of these essential equipment, it's worrying. It's worrying. And going through the report, I saw a connection between the geographical location of a facility and the kind of even equipment they have, and then the kind of services they have to create demand for the facility. So, for instance, you have a facility in the middle of the city, like 37, and then you get there and they'll tell you oxygen is not working. Then there's a problem, because at that level you expect them to have almost all the equipment needed for tertiary, you know, healthcare delivery. And then you go to a facility like a CHIPS compound in a community like Konzokala in the Upper West region, and they'll tell you there's no midwife there. The mere fact there's no midwife will block a certain demand that the facility is supposed to drive for the people, because if there's no midwife, then they can have some skilled services delivered, especially in terms of maternal and child health delivery. And so it's crucial that we pay attention to this report. It's crucial that we not just publish it, but government takes drastic steps to address some of these gaps in health delivery. Because at the end of the day, health system, our complex health system can only be made useful to the people when the health practitioners have this equipment to work with. If they can't do diagnosis, if they can't do simple, to the extent there were even anesthesia machine is not there, it's not working, it's problematic. It means how do people do surgeries? How are they going about calling themselves doctors when they can't perform simple surgeries because the equipment they need, all the surgicals are not there? Then there's a problem. You get to the rural areas and they are in the masses, so I like to focus on them. They are the ones who are supposed to be served by primary care facilities. In our resolve to attain a universal health coverage by 2030, the CHIPS policy, the Community Health Planning Services, has been our major contributing factor to attaining the universal health coverage. Because look, by the CHIPS policy, establishment of CHIPS compound community health services, we are able to serve our people who are the masses and the poor people especially. And so when you're counting in aggregate numbers, once you serve the masses, then you're actually doing well in attaining what we call the universal health coverage. And so if we are going to equip these primary care facilities with the basic things they need, like personnel, in terms of personnel, skilled personnel, in terms of some retroviral materials, in terms of the malaria treatments, malaria diagnostics, some of these.
For the malaria diagnosis, the report says that all hospitals,
they're able to diagnose.
Exactly.
Yeah. But
same as the HIV.
Okay, so that's for communicable diseases. So that's a good one. And even with that, it's not 100%. It's not 100%. So yeah, 85, right? Yeah. So we should be able to do more. I mean, no matter how you look at it, I want to believe because of government's focus on this Agenda 111, there's this neglect of all health facilities. And I get that from my conversations.
But is that Agenda 111 not a means to augment?
So while you do that, okay, as a political, with all the political climate around Agenda 111, people are getting sick. It's taking some time to get Agenda 111 projects ready. So what are you doing about it? We saw videos of Nsawam hospital leakage and all that. So people say Nsawam floods. It breaks the heart. It's disheartening that we are unable to maintain the facilities. The last time it was a hospital in the Upper East. Towards Navrongo Hospital. I think I sent to Dr. Nsiansari. These are issues you can't neglect because it has to do with the well-being of your people, the health care of your people. And so, whereas it is good to have Agenda 111 come in to support in terms of facilities, it's important we maintain the ones we have. We can't just for political score, focus and triumph, make so much noise about Agenda 111 when the ones we have, we are not maintaining them. You go to some of these, again, I'll go back to the remote areas. You post people that they don't want to go.
Especially the CHIPS compounds. Because a lot of them, according to the reports, do not have even a reliable source of electricity.
But you see, these are the problems. How do you go, if some of our projects contributed to some of these facelifts you see, that has allowed people to even go there. how do you expect people to live in these cubicles and all that? So it's important that government focuses on some of these primary care units. It's so crucial because those are the people who cannot. And my sister, do you know these guys don't suffer the kind of diseases we have at Konfanochi, Kolebu, and the 37. This is malaria, this rural community. It's malaria, tuberculosis, these communicable diseases. They don't suffer the stroke and these in the level we see in the
non-communicables.
Exactly, in the urban countries, communities. And so I believe it's not too much to ask that you furnish these places and then let's provide incentives for these workers who are posted there. You don't take someone from Accra to all the way to some remote areas, of course, to serve, but then there should be incentives that will drive them to go and even cause them to stay and work in excitement, in joy. Because at the end of the day, you need them there. You need health workers. You need skilled health workers in these remote areas too.
Yeah.
Unfortunately, they don't want to be there. And so the services they are supposed to render never gets, delivered. And the people in those places get to suffer. I believe it's about time we paid attention to this report. We try to take decisions that will, in the very shortest time, correct some of these things. It's for oxygen not to work in some of these tertiary facilities. It just doesn't make sense at all.